The latest study says Polycystic Ovary Syndrome, or Pcos, affects 1 in every 10 women globally. However, studies show that right here in Trinidad and Tobago, that ratio has increased. Gynecologist and fertility specialist Dr. Catherine Minto-Bean describes polycystic ovaries as a genetic condition found in women. She says Pcos simply means a woman has a number of small cysts on her ovaries, which sometimes make it difficult for her to produce eggs. These eggs allow women to have regular menstrual cycles and conceive children. The syndrome, she says, has many symptoms.
Polycystic ovary syndrome is when this picture of the cyst is actually affecting you and causing you to have some problems. So the commonest things people get are their periods are irregular, or they have unwanted hair on the face, or acne, or hair on the body, or they have infertility issues.
Dr. Bean, who operates from the Trinidad and Tobago IVF Fertility Center in Maraval, says in Trinidad and Tobago, 1 in 6 women have Pcos. She says a recent study shows in the last 5 years alone, over 4,000 women in Trinidad and Tobago diagnosed with this condition.
Trinidad in particular, we've had over the last 5 years about 4,000 people coming through our 2 fertility clinics. And when we look at them, we see probably about 40% of our patients have either been told they have polycystic ovaries or we diagnose it for them.
The fertility specialist says many times women have been misdiagnosed with this condition, and she cautions females to get tested accurately.
Ultrasound alone isn't enough. You have to have the irregular periods, or the acne or the hair on the body, or the signs of a hormone imbalance or infertility.
In addition, Dr. Bain says polycystic ovary syndrome is not a death sentence and it can be controlled.
If you have PCOS, you have a normal life expectancy. So it's something that a lot of women find devastating when they're given the diagnosis. And actually, we did a study in 2010 and we were so surprised when we spoke to women with PCOS. This was the other study we did. We were so surprised to find out that 1 in 10 women felt traumatized and really emotionally very traumatized by being told they had PCOS.
The Trinidad and Tobago IVF and Fertility Center plans to create a support group where women can have access to more information on Pcos. Marie Hall, Cnews.